to be stressed. Once my circle positive, then I man could care less. I had to get to that part. Too blessed to be stressed. Good morning, 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 neighbor. Sakitan Palilot, who here tell the others. Good morning, Grenada has officially started. Thank you very much for tuning into the program, whichever platform you're using on this beautiful, thankful Thursday. Appreciate you to the fullest. Trust you had a restful and peaceful Wednesday. Whatever you did last night, you were supposed to be inside since 7 o'clock, so I know it was a restful one. You were home spending some quality time with yourself or your family, so you should be well rested for this morning, man. Bless up your whole selves. Good morning, Grenada, Caracupiti, Martinique. Those of you tuning in across the Caribbean, whichever part of the region you are, a spicy Grenadian 473 morning to you. And those of you joining us internationally, good morning, good afternoon, good night. Hope you will have a good day, are having a good day, have had a good day. Thank you so very much. Let's get right into it. It's time for Word of the Day this morning. This morning's word of the day is muliebrity. It's spelled muliebrity. Muliebrity. I have to get it properly. Muliebrity. It is a noun which means womanly nature or qualities. Muliebrity derives from the late Latin word which means womanhood, and it also derives from the word which means woman. It is of uncertain origin, though the most common theory connects the noun to the comparative adjective which means softer, soft, calm, or gentle. Muliebrity was first recorded in English in the late 1500s. That's the word of the day this morning. Muliebrity. It's spelled muliebrity. Muliebrity. It is a noun which means womanly nature or qualities. An example of the use of the word: she is a poem, an epic of muliebrity in those satin slippers and light gowns. Another example of the use of the word: he offers something more suburban, up top, from muliebrity, from the waist down. That's the word of the day this morning, muliebrity, muliebrity, a noun which means womanly nature or qualities. Okay, I just got it. Okay. Yeah. Feminine. Womanly nature or qualities, I guess. Okay, that applies. All right. Word of the day this morning. I just thought of an instance where it would apply. I can't share it. Next thing I anger people and they call and complain about me again. I'm gonna just leave it there. All right, let's move on. Let's see what's the thought of today as we go about this thankful Thursday. And it came at a time because following our Good Morning program yesterday has been on my mind, and the thought came up this morning. So I'm just going to share it with you. The thought for today that you should apply to every situation: a little more kindness, a little less judgment. A little more kindness, a little less judgment. Especially in these times, time for us to be more kind, time for us to be caring, time for us to be tolerant, time for us to see every opportunity as part to grow, whether it's to educate ourselves and or others. A little more kindness and a little less judgment. Let's stop judging people, whether they think differently to us, whether they live differently to us, they eat differently to us, whatever they may be, different gender, different lifestyle, whatever it is. A little less judgment. We ain't have time for that these days. We just need to continue trudging life, give thanks for each day, and pray to God that we live to see the next one. So the thought for today on this thankful Thursday: a little more kindness and a little less judgment. All right, try and implement that today. Some of you need it. Oh, you're so upset me yesterday. All right, let's move on. Let's see what, we're gonna skip what's celebrated today. Let's skip what's celebrated today. It is International Day of Sign Languages today, but we are not gonna spend too much time on it. Just hail up all the people who participate in sign languages. It's a language I'm always intrigued by. Wish I could learn it. I've tried. I know one or two little things, but good morning to all the sign language people. I'm going to say sign languagers, but that doesn't sound right. Good morning to each and every one of you. Those of you who work with members of the deaf community, bless up all your whole selves. All right, information time. Wanted to get to that part. First, a reminder that this weekend is National Day of Spiritual Reflection and Prayer. That's Saturday and Sunday. There'll be prayer sessions on social media, on TV from 7 a.m. to 7 p.m. So it's a 12-hour sessions, Saturday and Sunday, spiritual reflection and prayer. So be sure to tune in, of course, to GBN platforms, and you will be able to participate in those activities. Testing and vaccination sites. There's a pop-up site taking place at the Pier 57 in Grand Mall on Sunday, God willing, 9 a.m. to 2 p.m. I promise that every time I see a pop-up testing and vaccination notice, I will share it with you. So this is one that I've seen last night. Grand Mall, Pier 57 on Sunday, God willing, 9 a.m. to 2 p.m. Remember to walk with an ID. You can get tested and or vaccinated at the pop-up site. So those of you in the area, just remember to wear your masks and to social distance from the people in front and behind you. On Sunday, God willing, I've seen a lot of clusters at these pop-up sites, so try not to do that on Sunday, Pier 57. And the latest dashboard, 196 new cases. What stood out to me was 10 more deaths recorded between Wednesday night and today's Thursday, right? Yes, today's Thursday. So Tuesday night and Wednesday night. No, man, that was something right. Between last night and the night before, 10 more deaths there. That's something better. Between last night, Wednesday, and Tuesday, man. Between Tuesday and Wednesday, 10 more deaths were recorded, COVID-19 related. We are now up to 85 COVID-19 related deaths. Active cases are at 2,194. 2,185 of them are local. Please continue to observe the protocols and stay safe. The numbers have not crossed 200 for the week, I believe it is. So let's hope that's signs of a downward trend of positives coming out of this wave of COVID-19 in Grenada. Let's get ready for the morning edition of news for those of you on radio and those of you on our visual platforms. Let's get into a repeat of last evening's newscast. Good morning, Grenada, on a thankful Thursday. Stick and stay. We will be right back.
Officials have now recorded the highest number of COVID-19 related deaths since the first outbreak of the virus over a year ago. There have been 12 deaths within the last 24 hours. With the numbers climbing, health authorities are concerned that infected people are opting to stay at home, and in some cases, they're self-medicating. Let's get that report from Rena Pierre-Thomas.
12 COVID-19 deaths in the last 24 hours, the highest number documented in Grenada since its first outbreak in 2020. The death toll on the island is now 75 between the ages of 18 to 103. Grenada has 2,260 active cases, 9 of which are imported, and 2,251 are locals. 72 people remain hospitalized. Senior Medical Officer Mayana Charles says most of the fatalities occurred in the community.
Now, as you mentioned, Grenada has recorded 75 cumulative deaths of COVID-19 and 12 in the last 24 hours. This is indeed an alarming number, but of the deaths we recorded in the past 24 hours, some occurred in the community, so persons who would have died at home, and some occurred in the hospital. And most of the deaths, again, are in persons who are not vaccinated.
Families are given a 72 hours time frame to bury their loved ones, far from the norm when it comes to saying goodbye. Health officials continue to advocate the need for the infected population to reach out for help before their conditions worsen, as waiting can lead to death. Charles laid out some of the signs they should look out for when the situation becomes extremely serious.
That anybody who is at home and are experiencing the warning signs of severe illness, please seek medical attention immediately. Because we have seen this. Persons are staying home until things are really, really dire. right? And some persons are not even seeking medical attention. So I want to reiterate that. And some of the warning signs you need to look for: persistent pain or pressure in your chest, difficulties breathing, new onset confusion, so persons not knowing where they are, they cannot recognize their family members, those sort of things.
Dr. Charles also discouraged persons from self-medicating with drugs that are not approved by the WHO. She says if they do it, it is at their own risk.
Our stance has always been to promote evidence-based interventions. We would not solicit or promote any intervention for treating COVID-19 that has not been approved. And ivermectin, sadly, is one of those. So persons, the Ministry of Health does not solicit the use of ivermectin, and persons who are taking this medication, I like to discourage them from that. And they're doing so, sadly, at their own risk, because the medication in itself has side effects.
The doctor was speaking on GBN's To The Point program with host Blossom Alexis Welch. For GBN News, I am Rena Pear-Thomas reporting.
Swabs are a challenge indeed. The acknowledgement comes from Health Minister Nicholas Steele. He says health teams at some pop-up clinics and health centers have been faced with challenges which resulted in people being turned away without being tested or vaccinated for COVID-19. He says this frequently happens when the teams realize a shortage of medical kits or health officials are not available to provide the service.
Blossom, we've been consistently receiving on a regular basis test kits. Logistics, as always, is a challenge in terms of making sure that they get out to the various communities in a timely manner, because the communities are using at a much faster rate than normal. So that has occurred in some instances. But in some instances where a site may be declared by us and chosen to be vaccination and testing, like one of our health centers or so, and then the nurse who's supposed to be doing the testing is sick, then it means that that site suddenly on that day, although the ministry has told people, yes, vaccine and testing, suddenly that site is not doing testing. So we've had those challenges.
The minister said despite this, the medical practitioners are doing their best.
We've had those challenges. And those challenges show up day by day, and we adjust as best as possible. We have a great team in terms of our community health team that is focused, that is adjusting, that is dealing with these challenges on a day-by-day basis as this disease evolves. And they're doing a really good job. They need to be congratulated, but we all need to understand that under these circumstances, there are going to be challenges.
Fingers are still crossed as Grenada awaits the outcome of discussions being held on the future of flights into the island. The country is presently on the CDC's very high COVID-19 travel risk list. Details in this report.
No cutbacks yet on flights to Grenada from other countries. That's according to Minister for Tourism and Civil Aviation, Clarice Modeste Cohen. Grenada was recently listed as one of the countries not to travel to, as the U.S. Center for Disease Control, the CDC, added more island destinations on the very high COVID-19 travel risk list. This would mean fewer flights into the country. So where does that leave Grenada as a country that depends on tourism as its mainstay for its economy? Minister Modeste Cohen explained that discussions are still taking place.
Well, we haven't seen any significant changes yet. Remember that they did say by the 4th of October, next month, that they will be providing more information, and by the middle of next month, whatever decisions they take by the 4th, that will be effective by the middle of next month. So we are still waiting on some final decisions from them, but we have not seen any change in bookings in that regard, and so we're just it's a wait-and-see situation.
Travel advisories have been raised to level 4 or do not travel. The countries listed include Grenada, St. Kitts and Nevis, Mauritius, Albania, and Serbia. Last Monday, these moved to level 4 COVID-19 or very high category on the CDC's evolving list of travel notices. The CDC advised people against traveling to locations that have been so designated. The agency advised that anyone who must travel should ensure that they are fully vaccinated. The CDC's travel notices range from level 1, which is low, to level 4, very high. Countries with more than 500 cases per 100,000 residents in the past 28 days are placed on the red alert listing. Chrislina John, GBN News.
Grenada's Airlift Committee is into negotiations with SVG Air to thrash out a 2-year issue that threatens the services between Grenada and Carrier Coup. GBN's Gerard Joseph has that report.
In May 2019, Managing Director of SVG Air, Paul Gravel, had categorically denied the pulling out of the airline from Grenada while admitting to financial challenges. Fast forward to September 2019, whereby Minister for Carrico and Diplomatic Affairs, Kindra Matthew Stewart, was again dispelling rumors about the fate of SVG Air in Carrier Coup. The government of Grenada in 2019 had confirmed a number of meetings with the management of SVG Air to negotiate a way forward. Andrews is now questioning what transpired in those negotiations, citing the importance of the airline to travel, medical emergencies among others. He suggested government use revenues from the sister isles to ensure the sustainability of the airline.
But the reality is that we generate sufficient income through taxes. So some of those should go to support the airlines to support the airline like that.
Minister for Civil Aviation, Clarice Modest-Cohen, confirmed to GBN that despite the negotiations with the management of SVG Air since 2019, nothing concrete was finalized.
In the operations of the country, sometimes you have a lockdown, sometimes you have no movement, and all of that. It has not helped the situation. And so what they have said is that they are running at a loss, and they may have to pull out, or they are considering.
Noting the importance of the airline for travel between the islands, government has again resumed negotiations with SVG Air, who has been performing at a loss for more than 20 years.
The CEO has also promised to give us a proposal as to what the situation is. However, the last thing I was told is that he had said that they're looking at charters in the meantime, and that a plane will be left in Grenada.
Minister Modest-Cohen told GBN that the Airlift Committee was expected to meet with the airline on Wednesday. I am Gerard Joseph for GBN News.
We don't often hear from them, and we're grateful to hear from them today. The Rastafarian community in Grenada say they're feeling a bit marginalized as a religious body when discussions arise on the COVID-19 pandemic. Christina John listens to their story.
Rastafarians in Grenada are echoing similar sentiments to their counterparts in Jamaica, accusing government of sidelining them from various discussions with religious leaders. Government convened a press conference Monday, engaging funeral directors and religious leaders on issues surrounding COVID-19. Their focus was to discuss government's decision to implement new measures regarding the safety of citizens and changes to funeral engagements. However, the Rastafarian community was not included on the panel.
No, we have not, because, and as Rastafari has been marginalized, and like we are, like we're not there, but we are there. We are there, and we are the soul of the nation. So we was not invited per usual.
Bongo Sarai and Sister Matara were guests on GBN's Good Morning Grenada program Wednesday. Health Minister Nicholas Steele, appearing on another platform, To The Point, was asked about the apparent non-inclusion.
First off, they have been reached out to, and no, there was no intention. It was not intentional. We reached out through Ministry of Ecumenical Services to the various organizations. And unfortunately, the Rastafarian organization is not part of any of those entities. So when we reached out to get as many people to table as possible. There was not an effort to reach out individually to the Rastafarian or the Jewish community. Both were not reached out to, simply because they were not part of the two umbrella entities that we are accustomed dealing with.
The Rastafarian community has also taken a firm stance on the issue of COVID-19 vaccination, opting not to support that measure, but instead relies on Mother Nature.
Staying safe is good. So, and I know everything we hear about go to take the vaccine is good thing. But the things we're not hearing, how to build your immunity, because we know this thing fight against your immune system. So what we as Rastafari doing towards ourselves, we keep building our immunity and reaching out to one another, which is the type of food to build the immunity, as Rasta say all the time. Eat healthy. Let your food be your medicine. And that's a practice as Rastafari we have. Letting our food be our medicine.
Chrislina John, GBN News.
This is the third week that businesses such as barbershops, beauty salons and stores are not allowed to operate as health officials attempt to flatten Grenada's COVID-19 curve. Despite the government's efforts to keep the country's economy afloat, some small and micro businesses are on the verge of collapse and owners are left stranded. GBN's Rena Thomas has been listening to the stories as shared by a micro business owner.
Shamela Charles is a local makeup artiste by profession in the parish of St. Andrew and had only officially opened her business in just under a year. The business owner broke down in tears on a social media platform on Wednesday morning, speaking about her situation and how the new restrictions have affected her. In agreeing to tell her story to GBN, she explains how frustrated and difficult it is to care for her basic needs and to keep the roof over her head.
Because this is my livelihood. This is my only source of income. This is how I manage to pay my day-to-day bills and stuff. With my business being closed, having a rent to pay, having utility bills to pay, don't know where the next salary is going to come from. I'm like, what next? Who do I turn to? How do I function? It's not easy, Rena. It's not easy, and it's hard to hold back on tears right through, because I might be in this position, but not knowing where somebody else might be as well, because I'm not only speaking on my behalf, Rena, but all the small businesses on a whole is being affected by this closure. It's very, very, very frustrating. And I say frustrating, meaning mentally, physically, emotionally, spiritually. It's really affected me in all forms I could think about.
Charles says that while she understands the COVID situation in Grenada, the pressure placed on micro businesses is too much.
I don't know if it had any other way of dealing with it, meaning that if they probably could have said, well, allow one person or two persons for the most, and kind of, adhere to the rules and regulation that was stipulated for us. But it's nothing like that. And I don't know what they expect us to do as a people, if it's probably I can't say go on chief because we will get locked up. I can't say sell myself. I don't know, because that's not me. So I'm trying to think about how else they want us to do it. It's not to say like there's any other option left in this times now.
The business owner is asking those in authority to rethink their approach and reach out to small business owners who are seriously affected.
I'm just kindly asking if the government could look into our situation, not just me alone, but even the persons who sell the little vegetables, because you can't even get vegetables as you would like to. Your little crops, just help us out in some way or the other. Small as it is, we would be appreciative. And in my situation, with the fact that I have not my own personal home, but I'm renting, I can't afford to just sit down here and put myself in debt that I can't afford.
The new protocols outlined on Monday added 2 more weeks of curfew and no movement days, indicating that these workers will not return to their daily trade as their business doors have to remain shut. For GBN News, I am Rena Thomas reporting.
A very dicey situation facing Grenada and a lot of other countries around the world. Moving on now, a local family is calling for assistance and systems to support, trace and monitor active and potential cases. And this is being seen as severely hindering and due to a drastic increase in the country's COVID-19 count. Gerard Joseph has that story.
The frustration has spilled over for a single mother who tested positive for COVID-19. The individual, who chose to remain anonymous and sought GBN to highlight her plight, says she feels helpless. Upon contracting the virus 2 weeks ago, the individual said she was told that in 7 days her children will be tested. However, she told GBN that was not to be.
They haven't called me up to today or nothing. And 2 attempts, I tried calling the virus department, which is the Ministry of Health. They take the information. They never show up. They never call or nothing. And up to today, I'm finishing my isolation Tuesday. And nobody hasn't come to visit me or my children or anything.
Dr. Mariana Charles just last week alluded to the contact tracers being overwhelmed by the numbers. Dr. Charles on Wednesday, addressing the issue of positive cases being allowed to resume normal duties without being retested, said it's based on the Ministry of Health's guidance.
I'll tell you this, the World Health Organization recommendation, right? When a person becomes infected with COVID-19, if that person have no symptoms at all, the isolation period that is recommended is 10 days. Right? If that person has symptoms, the isolation period recommended is 10 plus 3 days. Right? And the reason for that, and the science show that after that period, right, persons are deemed as no longer infectious, meaning they're not able to pass on the virus.
The COVID positive individual, however, confirmed to GBN that her children later began showing symptoms, with her mother recently displaying the same, while her isolation ended on Tuesday.
Emotionally, it takes a lot because I was dumb and I couldn't get around to do stuff for my children. They had to actually help themselves. And sometimes my mother come to give support. Yeah, so it affected me.
The single mother made a clarion call for assistance.
I find the service is very poor, and I think we as a third world country, I believe that they could do better than that and put things in place for people like me, I could say, because if I had the money and I decide, well, I go in private to get it done, then it wouldn't be an issue. But you need to come and help others. Don't just think about themselves.
Chief Medical Officer Dr. Sean Charles issued a message last week to Grenadians on how to break the chain of transmission.
All right, your family needs to have a plan. All right, everyone comes from, different locations. They may work in different sites, but they all come together at home. So at home, you need to make a conscious effort to follow the protocols as well. You need to wash your hands. You need to wear your mask. Prevent the disease from entering your family.
Health Minister Nicholas Steele and the medical team continue to urge Grenadians to volunteer in the fight against COVID-19. I am Gerard Joseph for GBN News.
Thanks, Gerard, for that report. And now, let's take a little light side through the GBN ISO lens.
Our ISOR reporter came across this roadside hazard at Cocoa Road. Our reporter says that the pieces of iron were left exposed. This exposure, according to our ISOR reporter, is very disturbing and hazardous, as walkers can get hurt and vehicles' tires could get damaged. Our reporter stated, quote, "As a driver, I am concerned," unquote. They are calling on the relevant authorities to attend to this roadside hazard. We thank our ISO reporter for this submission. Continue to send us your photo and video submissions via WhatsApp on 405-3052 or our other social media platforms.
Those who need the Pfizer second dose have been assured that supplies are available. We go to Christelina John for this report.
people who have within the past 3 weeks taken the first dose of Pfizer vaccine are now questioning whether or not they will get a second shot due next month. The question was put to Minister for Health Nicholas Steele during a news conference Tuesday. Where does this leave people?
We constantly have vaccines coming in. So we will make sure that individuals have vaccines. In fact, our issue has been the opposite. We've had too much vaccines and not enough people coming. So yes, for sure, we will have vaccines available for any and all individuals who would like to be vaccinated.
Appearing on GBN's To The Point program Wednesday, Dr. Mayana Charles says there is still time left on the present supply.
The date is at the end of November.
Oh, okay, all right.
The U.S. Food and Drug Administration extended the time Pfizer-BioNTech's COVID-19 vaccine can be stored in the refrigerator. Doses can be kept frozen in these containers for up to 30 days, as long as dry ice is used to maintain temperatures of around minus 70 degrees Celsius or minus 94 degrees Fahrenheit. Grenada received 29,250 Pfizer COVID-19 vaccine doses on August 18th, 5 days before it received approval from the Food and Drug Administration, which was on August 23rd. The vaccine, which has been approved for 2 doses, 3 weeks apart, was rolled out in Grenada on the same day it was approved. Pfizer-BioNTech vaccine received full FDA approval, making it the first licensed vaccine for the coronavirus. It remains available for emergency use and has gotten authorization for use in children from age 5 and adults. However, here in Grenada, such a decision has not yet been reached. That's according to Dr. Charles.
Again, we would wait to get approval and wait for it to be approved in that age group before we make such a decision.
Health officials hope that the first FDA-approved COVID-19 vaccine will boost the public's confidence that it meets the high standard of safety and effectiveness. The vaccine approval is said to be the swiftest in the agency's history. It has come less than 4 months after Pfizer-BioNTech filed for licensing on May 7th. Chrislina John, GBN News.
Foreign ministers from Grenada and other Caribbean community member states have been holding discussions with United States officials on a wide range of issues. The talks have been spearheaded by the Deputy Secretary of State, Wendy Sherman, and they've been looking at a number of issues ranging from climate change to vaccines for the coronavirus pandemic. The foreign ministers impressed upon Ms. Sherman the urgency for the delivery of the second tranche of the donations of Pfizer vaccines to regional countries. The United States delivered the first shipments of the Pfizer vaccines last August, with the second shipment planned for this month. A statement from the CARICOM heads, the CARICOM foreign ministers, said that they, while expressing their deep appreciation for the generosity of the United States, they underlined the importance of maintaining the schedule given the spike in COVID-19 infections.
Are you looking for quality herbs and herbal supplements, or are you thinking about having a complete body cleanse to jumpstart your health? Then no need to look further. Visit Nirvana Natural Health Clinic, Detox Center, and Natural Health Store. We carry a wide range of herbal products for kidney and gallstone cleansing, male sexual enhancement formulas, asthma and sinusitis, gas and bloating, acid reflux, constipation, arthritis, imbalanced hormones, female health issues, liver cleansing, weight loss, and so much more. Also available, colonic irrigation, holistic health consultations, essential oils, and diffusers. Look out for our online natural health store coming soon. Call 231-6642 for 18-7115 or 449-7753 to find out about our delivery options or to book an appointment. Visit us at Belmont St. George's, close to the Fallage, Monday to Saturday, 9 a.m. to 6 p.m. Nirvana Natural Health Clinic. Detox your way to health. Once upon a time, we shopped at Wonderland, then Neverland. But we're all grown up now and no longer believe in fairy tales. So now we just shop at Shoes R Us. At Shoes R Us, we stock the latest in shoes, tops, and jeans for the fashion-conscious lady. We also carry colognes and much, much more. And for the modern trendy male, we have the latest brand name shoes and sneakers, Converse, Reebok, Nike, K-Swiss, Puma, and much more. So check us out at our two convenient locations, Melville Street in St. George and Ben Jones Street in Granville. At Shoes R Us, we say, come shop with us.
Get Rubigas. Get cooking. Rubigas, clean, safe, and reliable LPG is the perfect solution for your commercial and everyday needs. For cooking at home or barbecuing, choose Rubigas LPG cylinders. Available in a variety of sizes from 20 to 100 pound cylinders. Rubigas LPG, clean, safe, reliable. Are you cooking with Rubigas? Get Rubis, get going.
Level of convenience and comfort awaits you when you shop at Rise and Shine Supermarket and Hardware Supplies, Griffin Lane, Grenville. Convenient, because we are open Sunday to Sunday. We're even at your service on public holidays. Comfort, because we are easily accessible to the physically challenged. Free Wi-Fi is available while you shop, and bags come at no charge. Everyday low prices and excellent customer care. Adequate parking available. We supply everything you can possibly think of. Family and home supplies, fresh meat, vegetables, and personal care products. All brands of cooking gas at affordable prices. You can send in your order, have it pulled, or pick up express.
Disaster Management Agency, NADMA, reminds the general public to always be prepared. Make sure you have emergency supplies stocked away just in case. Here is a list to help you and your family. At least 1 gallon of water daily per person for 7 to 10 days. Enough food for at least 3 to 7 days. Non-perishable packaged or canned food and juices. Special items and food for babies and the elderly. Non-electric can opener. Cooking tools and fuel. Paper plates, plastic utensils, paper cups, trash bags and duct tape useful for cleanup or patching leaks in an emergency, blankets, pillows, first aid kit, medicines, prescription drugs, toiletries, hygiene items, moisture wipes, tarpaulin to cover holes if needed, bleach, water purification tablets, flashlight with extra batteries, battery operated radio, cash, small bills. Banks and ATMs may not be open or available for extended periods. Keys to house and cars, toys, books and games. Important document in a waterproof container or watertight resealable plastic bag. Up-to-date insurance, medical records, bank account numbers. Keep important phone numbers here. You may know them, but a loved one may not. A pocket knife, nails, a hammer and a rope are important elements. Towels and buckets are useful too if you develop a leak. Vehicle fuel, keep tanks filled.
A message from the National Disaster Management Agency, NADMA.
Mike, where's my theme, Mike? Where's that one? Good morning and welcome back to Good Morning Grenada. It is now 18 minutes after 7 o'clock. Those of you who are just joining us on whichever platform you're using this morning, happy to have you. And those of you who stuck with us, thank you for your patience. This morning, it's time for us to get into a discussion, something that would definitely benefit some of our vulnerable families here in Grenada. I have joining me virtually are Simon, Catherine, and Sherry, and they're going to tell us about an initiative that they've termed the Samuel Family Initiative. So welcome, ladies and gentlemen. Thank you very much for joining us this morning.
Good morning.
Good morning. Thank you.
Good morning.
Thank you. Good morning.
Happy to have you. So let's start from the beginning. The Samuel Family Initiative. This initiative is really aimed at benefiting some of our families in the rural parts of the island. Tell me how the idea for this came about. Who's going to start?
Okay. I'm going to start, Blossom.
All right, no problem.
Okay, again to Grenada, Carriacou, Petit Martinique, and the diaspora and Grenadians. We originally, the Samuel family is from a little village in St. Patrick called Snell Hall. And we're a very large family. Most of my siblings have migrated into Canada. And we see the need of giving back to Grenada, especially St. Patrick, where we're from, that area. As the things are happening in the world today, we think as a family we're blessed, and we want to just give back what the Lord has blessed us with as a family, in terms of my family getting together in Canada and putting things together like mask and sanitizer and gloves and all that goes with the COVID-19. And they're able to come up together in less than a week, Blossom, and gather so many things together to get ready to distribute in the different homes and the area of the rural community of St. Patrick.
So what were some of the things that you've been able to gather, and who contributed?
Okay, I should say, because my family is that big, we have my first sister named Eula. She was a nurse in Grenada here during the Gary era in the early 60s, 70s. And myself, then after, well, I'm in Grenada here. So you have Eula, who was known as Nurse Samuel. Then we have Agnes. Then we have Simon, Winnet, Wendy. I'm going to call them how we know them, like home. Simon, Winnet, Wendy, Eula, Agnes, Randy, and we have three other brothers.
Yvette,
and it's a whole bunch of them. And so we're happy that they were able to do that in a short space of time. And most of the things they have gathered, Blossom, is mask, shield, hand sanitizer, and maybe Yvette might just give us a little idea of some of the things that I miss at this time.
Okay. Good morning again.
I'm sorry, Miss Catherine, you lean forward and you cut off your face.
Sorry.
Right, that's okay. All right, go ahead. Now we can see you.
We got lots of gloves. We got lots of hand sanitizer, wipes, hand soap, disposable shield, face shield, disposable gowns, and we're still waiting on a lot more because people are still contributing every day. We are so honored and blessed in this family that people are just calling and donating so many things to us, and we're so grateful to do that and to contribute back to our community back in Grenada.
Was it being blessed and with people contributing, was it a difficult task to get people to come on board? Did it take a while, or they hopped on board one time, same time?
Just right away. Right away. As soon as we sent out that email the Sunday night, like Monday morning, things were flowing to us. Because we're very known and very friendly with everybody here in where we live in Canada. And, we're happy that, that we can do that back for our country.
And are you only gathering and sending PPEs or those that we can use to protect ourselves in COVID-19, or are food stuff being made available as well?
We're just working right now on the stuff for the COVID-19, and that's a good idea. We can even think of doing food stuff also. Thanks for that advice.
Oh, well, you're welcome. And how would you go about identifying who can benefit from this initiative?
Okay, well, we're targeting more the vulnerable people, the people in the community that maybe don't have much to go by. So Sherry could be able to elaborate more on that one. Sherry, can you please take over?
Okay, Blossom, because I live here, and most of the homes, the institutions, because sometimes, Blossom, things come and some people get so much and some people get little and some people get nothing. So because we're from St. Patrick area, we have identified all our villages in St. Patrick. So we're going to make a time together, my husband and I, and we're going to organize ourselves together with maybe nurses and police officers, and we have to get it right to know how we're going to do that. So we have the institution, which is some of the homes. We have about 22 homes, Yes, altogether, about 22 homes, institutions, and the people, first and foremost, in the St. Patrick area. So these are the people we're really targeting. We're probably going to do it in a way, adhering to the protocol, doing it maybe a Sunday evening set up somewhere, and just let people know the first 1,000 people, we're going to get something, and we're going to continue going until the stuff is complete.
So have you been in touch with residents in St. Patrick in terms of how they are dealing with COVID-19? Not identifying families, of course, but those who may have been affected by the virus, whether they've gotten it themselves or they know someone who's gotten it. Have you had that conversation with residents in St. Patrick?
To be honest, I had a conversation with St. Patrick, and it's really critical. One of the homes say like they cannot even... it's so hard for them that most of their staff is on, what do you call it, isolation? Right. And it's very, very St. Patrick. So I had conversation, and as you say, we will not identify, but I had, and it's critical. It's heartbreaking. It's awful. So I don't know. We just have to continue to do what we were blessed with as a family to do, and see where it takes us for the next move,
Right. And Simon, you can come in here, and I see Miss Eula entering the waiting room as well. Simon, tell me about your thoughts on this initiative to assist vulnerable families, specifically in St. Patrick.
So thank you, Blossom. Good morning to Carriacou. Grenada and Peter Martin. I put Carriacou first, as you see, because we tend to leave them behind and focus on the mainland. But in all fairness, we all won. Again, my name is Simon. I'm just going to give you a little bit of background about myself before I go into Blossom, if you don't mind. Mm-hmm. So that initiative. It's so important and it's so dear to us. I'm in Canada here, and I'm involved deeply in the community. I was the vice president for the Grenada Day Cultural Association for the past 10 years, and also involved in other communities. I'm a co-founder of a men's group in Toronto here, men that we focus on prostate cancer, and other groups that involve Grenada, like the GIPC, that Independence Planning Committee. And like one of my sisters said, that we are very well known in Toronto here. We're very friendly. A lot of people knows us. So that's why we take the initiative to do that. Now, this is not the first time we are doing that. It's the first time we come on this platform, and we again thank you for bringing us to sort of explain and let people know what we're doing. Our family did send over 400 backpacks to various schools in St. Patrick's. And we also did the cricket gears for the kids in St. David, which is over a few $1,000 worth of items. And then we also doing the books for the library. And now we take on this project. And this project, like Catherine was saying, that it didn't take us too long. It's just, you talk about it and everybody jump on board. And we're still getting items. And it's right now we have lots. I would say we have over 20,000 items to send out. So it gives us this this good feeling that, as a family, we can get together and do this for our country and also our community.
What about the costs involved in packaging these items and sending it? Would that be a financial burden for the family? Maybe not burden is a word, but a financial injection, a great financial injection for the family?
Well, thanks for asking. Good question. What happened is, in the donation, when we asked for donation, we didn't only get the mask and the sanitizer, we also get monetary gift. So, we have we collect quite a number of donation. That itself would help to ship the barrels and to also clear on the custom, and on, the surplus would also do other things. Like you said, we talked about the food a while ago. So that would be another initiative that will be undertaken in the near future. But because of our kindness, also, the monetary fund would not be hard to accept. And we still get it. You send the word outside. Somebody just sent me some money just last night. So, it kept coming.
There may be people who are considering, doing an initiative like this, but for whatever reason, they're not really encouraged. How would you say somebody should go about this? Because a lot of people have ideas, but sometimes they don't know how to approach it. How would you say somebody can roll out something like this, whether it's for another parish or a family or even for the entire island?
All right.
Sherry, go ahead.
Okay. Everybody have their gifts and their talents. Some people, we're born to do different things. And if you know that one of your gifts is giving back to people that we as a big family in St. Patrick, our parents, our father passed, and our mother is still in Canada. She's almost 90. And because we know where our gift and our talent lies, we were able to do that quite easily. There is a lot of people that know in their mind that they should give because they know where they come from. They know where they came from, so I will encourage you to search, especially now in this time, search and see where you have been blessed over the years, search and see where people have given you where you didn't have. Look and examine yourself and see what is it in for you now. Is not you're looking at people thanking you. This is just you. It's just a normal something we do as a family. It's in us. So I know that there are more people, especially in the diaspora. And I bring up the diaspora because, Blossom, we tend to disrespect the diasporans, Grenadians, so much. We call them names. We say all sorts of things about them. And sometimes they feel that they're not Grenadians. Sometimes they feel that they're not wanted, and we only need them when we only want them when we have a need. So this is another thing probably that could deter them too, because how we look at them. So I'm encouraging them, put away the doubts and the fear and step up a little closer to what is happening home, where we have so much deaths and people dying. So we want to encourage you to first pray about it, because sometimes you run and do things because you see other people doing things. Because I see the Samuel family or the Chaitan family or other family doing things, I feel I want to do it too. And somewhere along the line, it's not your feeling, but it's what you are called to do.
We are joined by another sister, Miss Eula. Good morning, Miss Eula, and welcome to the show.
Yes, morning.
Morning. Tell us about your role in this initiative to find or get support and send to the people of St. Patrick.
Thank you. Very nice. I'm happy that my sister could able to help us out on the other end of the spectrum, the beautiful Isle of Spice. We're doing all we can to help out the community.
So with the
Blossom,
yes, sure.
Blossom, go ahead. Can I just interject for a second?
Sure.
I just want to make some correction here. Well, not correction, but I just want to add in something here. So the project is not only for St. Patrick's, also involves St. David's. So I just want to add in that. Yes, I just want to put in that. So it's a St. David's and St. Patrick project, and the rural areas like Sherry mentioned, and some of the homes. Just to add in that.
That's right.
And while Ms. Sherry spoke about being able to, go out to these parishes and identify who families are, there may be some families that we're not aware of. Is there an avenue for a family to reach out to you in hopes of getting assistance?
Yes. So I'm going to work along with police officers, and there is teachers. There is nurses. There are also people that work in the lab. And so I already reached out to them so that they could spread the word. Well, Facebook is quite there as well. So the word, you see, Blossom, when you have to give things like this, I tell you, the word reach so fast, you will never believe. Because remember, it's not something you're buying, it's something that you really need. So one will tell one, you tell one person, and the whole community knows what you're doing. So example, you set up in Montreat somewhere, or you move to Montreal, it's like you cover the whole place in 1 hour. Because the families and the communities are so knit together, the villages, that it's quite easily to do something like that. But I've already spoken to people in authority. I have to get permission from the health authority to know how to go about it, because, I still don't want to put myself in harm's way, because my husband and I will be the distributors. So we have to fine tune in the meantime as my siblings work up there. We do not like a fine tuning down here as well.
With the show of support that you've seen from people who have contributed, it's probably early days, but what other plans you have to assist vulnerable families, and any plans to spread the love? Let's put it that way: spread the love from just St. Patrick and St. David.
I don't know if Eula could answer that, because you started with her, and we don't want to kind of leave her. She probably, as a nurse in Grenada, she might be able to come out, say something on that.
Well, you got me off guard there, but I really feel very sorry and sad for my country, because I was trained at home in the 70s. And the registered nurse midwife came to Canada in the 80s. And then I always go back. When I go to visit, I always go back to the hospital and see some of my friends, most of them are retired now. But I haven't really thought about anything yet at the moment for future, but that is something I could think about, because now that things are changing a lot, we can probably get together with my siblings again and figure out something, next plan that we have. Right now, I haven't really thought about anything yet. We're just doing this present project at the moment, and we'll see where it goes from here. But I'm sure we'll have more plans in future coming up, and we'll let you know, Blossom.
Understand.
Blossom, just to reiterate a bit. Well, we did have just a brief. We had a meeting last night, and we did mention briefly a continuation of what we're going to be undertaking. We didn't really zero in on any project itself, but because we started and we realized that it's a good initiative that we're embarking on, and we decided to continue. Whenever we decide whatever project and whatever is needed, I know it's going to be always needed, but we're looking at the most important thing that would be needed. For example, if there's a natural disaster, I'm just showing that likely we might get involved. We will get involved, because this is what we're all about now. And we realize that with what we did before, we're very successful in what we do. So the possibilities are, you're going to hear from us again.
And this is a good opportunity to hear from Ms. Catherine, Simon, Ms. Eula, about the COVID experience in Canada, where you are. In Grenada, we are experiencing our wave, but I know Canada has also gone through it as well. You have also protocols in place. From your perspective, being out there in Canada and experiencing, can you maybe just look at or maybe compare how it is over there as opposed to how Grenada is going through this period?
Well, in terms of where we are in Canada here, so I'm going to just cut it down in Toronto for itself, because we could go Canada, we could go Ontario, and we could go Toronto.
All right.
So let us look at Toronto, where we are. The numbers are fluctuating. Sometimes you're up in the 500, but again, it would sound like a big number when we look at the capital. We all over 2.something million people, right? So the government has sort of put things in place. We sort of ease up the gathering. I think it's right now it's 100 people outside, and I think it's 50 inside. So that's indoors. So they're sort of putting things in place gradually, but I think we sort of, I don't want to give you the wrong information, but in my opinion, I think we sort of on a little bit of decline. We're not as before, let's say, but last month when the peak was very high. So that's where we are right now. But I think in overall Canada, it's a big number. I cannot give you an exact number, but it's a big number.
All right.
And it's going to look, as for Grenada, it's I'm always in top of what's going on. I just get the dashboard from a friend of mine, and they're showing about, I think it was 83 yesterday. So that's what I was looking at. But it's kind of scary because, again, based on the population, this is what's frightening. Based on the population in Grenada, you have this number. So it kind of frightening and make you, wants to do more, especially in this COVID time.
Can I just chime in a little bit?
Sure.
Compared to Grenada and Canada, as my brother said, it's a lot of a difference. And we seem to have more positive testing than and deaths, like I said, per capita, because our island is so small, and it seems like if it's a whole lot of, because if 1,000 people die in Grenada, like that's almost, how much percentage of the population already, because we're so small. So my advice right now, and I'm a vaccine encourager, because I had my both vaccine for us to travel, we have to have our vaccine. So I am saying to my residents that are listening, please take the vaccine. It's not going to kill you. People are dying more from the virus than from the vaccine. And this is just my perspective. This is not anything political or anything, it's mostly like medical, because I'm in the nursing field. And I just retired just before COVID, I just retired. So I think it's scary when people's family are just dying, one after the other. It is difficult. It is very stressful. It gets people depressed. It affects the whole family. And because the virus is so terrible, a lot of people don't believe in that. But they're seeing the results of it. And it's so sad. How can we change people's perspective and change their mind? It's difficult to change somebody's mindset. I'm not saying that people are not worried and they're scared, but take a chance and do it for your family and for your health. Otherwise, once you get to the hospital, you're not sure you're getting back. That's just my little bit of advice.
Good advice.
That I want to give you there.
Good advice. So just a reminder, can people still contribute to to the initiative, how can they do so, and how soon do you think you'll be able to distribute to the vulnerable families?
Yvette?
Simon.
Okay.
Yeah. Well, people are, like to say, people are still contributing.
Yeah.
And we have our numbers. People have our Facebook.
Yeah.
Each and every one of us have Facebook. So we send out our Facebook. We send out our numbers, our phone numbers. We send out our WhatsApp numbers. And so everybody, like we say, we are very well known. Everybody see us on the road, and we talk about it. It's like, okay, I'll send you this and I'll send you that. So it's very like the popularity is there. So the popularity is there, and then the donation it kept coming in. But Blossom, what I wanted to say is we don't want to leave out the sponsors, the people who donate. Mm-hmm. We want to give special thanks to them. Mm-hmm. Very, very, from the bottom of our heart, as a family, and we get that giving back from our grandmother. So our grandmother is that set the trend. You grow up with a grandmother, and she always have people around her, and food in the pot, just waiting for somebody to pass. And then we move that to our mom or our father, and now we take up the baton and run with it. And I hope our children would continue. So it's like it's like a domino effect. So I really want to thank each and everyone for the contribution and people who continue contributing. And we hope we can do this on a continuation basis.
How soon you think you'll be able to distribute, send down Sayo?
Well, we are looking right now the ending of the week. So the first week in next month, we are going to get all the barrels and everything packed in. So the first week, we are going to send that the barrels likely is going to be 2 barrels, likely could be 3. But we already know that we have 2. We have 1 huge barrel and many, many more coming in and many, many more to pack. So likely it's going to be 2 plus another one. And just an average. Like I said, I think I said we have over 21,000 items already that's collected. So that's a big margin.
And is there an item, while you've been collecting a lot, is there an item that you need more of?
Well, I think what we need, we send out the call and we get a lot of the masks. So I think the mask would be more important. All of them is important, but I think mask right now in Grenada is one of the key things.
Yeah.
And like what I think Catherine said, we had this hand sanitizers, we have the gloves. One of my sisters also is in the medical field, and she's also getting quite a number of gloves. The gloves will be distributed like mainly in the homes, like the staff in different homes. But the mask, I would say, it would be all over. Hand sanitizer also would be, depends on the size. We have various sizes, so it depends on the size. The homes are other, like a big family might get one of the small hand sanitizers. So that's what we are hoping for.
All right, let me just, there's a comment on Facebook. Somebody says, to the Samuel family, your dad would have been so proud if he was here. Follow it in his footsteps. Blessings.
That's right.
Oh, thank you.
Thank you so much.
And somebody else.
Blossom, that's why I sort of bring in that, because a lot of people, my dad, are very, very well known. God rest, may he rest in peace.
Yeah.
Very, very well known. Very helpful. He ran his business, and he didn't run his business only to make money, but he ran his business to help. Mm-hmm. And there's, my dad had the bus, the truck, the car, the everything. And if you're asking for a ride, he's not looking for money. Just give you a ride to bring you where you have to go. So, thank you, the person who made that comment. I assume that they know us very well. I didn't know my dad very well. So thank you so much.
And another suggestion on Facebook, somebody says, have you ever reached out to Mrs. Moses and Oliver Joseph to get assistance? Okay, the MPs, I just catch. The MPs for St. Patrick and St. David, Mrs. Moses, Oliver Joseph, to get assistance with the shipment and clearance at the ports. They say this is something that you can possibly look into.
All right, so let me answer you with that.
Yeah, sure, yeah.
Okay, because I'm on the receiving end, someone is working on that for me, and we're going to see where it goes for duty concession. And but we still have a little donation in hand just in case, because we know things are hard in Grenada too, and sometimes we want the concession, but we still want the government things have to happen. So we're working on the concession. We're working on that, and by this weekend, we should be able to know if we're in on that or not. But we're still going to pursue either way. Either way, we still pursue. But we're working on it.
All right, good to know. Thank you very much, ladies and gentlemen, for sharing, and thank you for what you're doing for residents in St. Patrick, St. David. Hopefully, other people can benefit as well. So we appreciate you. We appreciate what you're doing. And is there a contact information somebody can reach you? Maybe somebody in the U.S. who wants to send over something, a contact number or so?
Yeah, you can call my number 416. This is Simon, 416-712-3563. That's my mobile, and that's up 24/7.
All right, 416-712-3563.
That's correct.
All right. So I'll pass it on if there's anybody that's looking for it. So thank you once again. Congratulations. We appreciate your assistance so very much. If there's anyone who would like to reach out to the Samuel family, 416-712-3563, and you can contact them and see how you can donate whatever you'd like to donate. So thank you once again to the family, and enjoy the rest of your Thursday and stay safe.
Thank you,
Blossom. And have a nice day, Blossom. Thank you.
Thank you. You do the same. Members of the Samuel family, they are contributing some PPEs to residents in St. Patrick, vulnerable families in St. Patrick and St. David. So we thank them very much. Let's take a quick break, and then we're going to come back and wind down Good Morning Grenada on this Thankful Thursday.
Are you looking for quality herbs and herbal supplements, or are you thinking about having a complete body cleanse to jumpstart your health? Then no need to look further. Visit Nirvana Natural Health Clinic, Detox Center, and Natural Health Store. We carry a wide range of herbal products for kidney and gallstone cleansing, male sexual enhancement formulas, asthma and sinusitis, gas and bloating, acid reflux, constipation, arthritis, imbalanced hormones, female health issues, liver cleansing, weight loss, and so much more. Also available, colonic irrigation, holistic health consultations, essential oils, and diffusers. Look out for our online natural health store coming soon. Call 231-6642 418-7115 or 449-7753 to find out about our delivery options or to book an appointment. Visit us at Belmont St. George's, close to the Foliage, Monday to Saturday, 9 a.m. to 6 p.m. Nirvana Natural Health Clinic. Detox your way to health.
State-of-the-art Ultratech gasoline and diesel, available only at Rubis stations.
Imagine having the home of your dreams. Imagine investing in that piece of property you can call your own. Imagine finally doing that home improvement project you've always been thinking about. It's time to stop imagining and start doing. Let the GUT Credit Union help you take the first step with fantastic rates, affordable repayments, and reduced legal fees. Make the move. Get better terms on your mortgage. Use your home equity to make those dreams a reality. Act now. There's really no place like home. GUT Credit Union. It's where you belong.
Welcome back to Good Morning Grenada. Mike, why are you not playing my theme, man? Get it together. All right, welcome back to Good Morning Grenada. I'm just back to wish each and every one of you an enjoyable, thankful Thursday. This is where we're going to end the televised portion of the program. Thank you very much for tuning in. Thank you, those of you on the Facebook. Good morning, Facebookers. Kim, Kipling, Alistair, Wendy. Good morning, Alpha. Be nice, na Alpha. Those Cynthia, Chris, Ernesto, one of the loyal viewers here on the program. Chris, Siobhan, Ingrid, thank you guys so very much for tuning in. Margaret, Alistair, appreciate you. Kipling, Francis, bless up your whole self. Thank you very much for tuning in. Continue to be safe. COVID-19 protocols are in full effect. Beaches are open. One of the things I'm grateful for, beaches are opened until, beaches and rivers, opened until 1 p.m. daily, so you can get a little extra hours on the beaches. Something else that crossed my mind to share and I forget. I'll try and remember by the time I come back to the point. Enjoy the rest of your Thursday. Wear your masks. Wash your hands using soap and waters for at least 20 seconds. If they're not readily available, hand sanitizers with I think 70% alcohol will do the trick. Social distancing. Those of you on public transportation, always have to remind you to please wear your masks for the entire journey. We know that the buses are, at least most of them, are packed almost to capacity. You need to ensure that you are safe. One of the advice is to limit or stop completely talk. Don't talk. That paves the way for particles to be flying left, right, and center. And with the breeze blowing in the bus, they're going all over the place. So no talking in the buses. Wear your masks. Please hand sanitize. Walk with yours. If the bus drivers and conductors are not providing, walk with your own so that you can sanitize your hands and you can rub off your shoulders if you were rushing up against another passenger, just to be safe. Walk with your own. I have mine. I probably have about 5 in my bag alone. 5 in my bag alone. I ain't taking chances. Continue to be safe and observe the protocols. Let's end the televised portion in just about 5 minutes. We're going to join the BBC for its 8 a.m. newscast. Please continue to be safe and have yourselves a safe, enjoyable, thankful Thursday.